Steven Snyder with another edition of Performance Enhanced Benefits. Let's talk about reference-based pricing. Reference-based pricing in healthcare is an alternative to traditional pricing models that generally attempt to stabilize and/or reduce the claim costs. Reference-based pricing will pay claims based on an established benchmark rather than a predetermined fees you may already be used to. This pricing model is more common in a self-funded health plan. A version of a self-funded health plan is a level-funded health plan. I did a video on a level-funded plans a couple months back. If you want a refresher, go to my YouTube channel. Reference-based pricing will typically work with the Medicare pricing grid plus a percentage. When a medical procedure is to take place, the reimbursement for the claim is many times negotiated before services are rendered. This helps to eliminate the frustration of not knowing how much it's going to cost until after you receive the medical treatment. And knowing how much it will cost can allow for the insured to either save up for the treatment or shop around and see if there's a less expensive option. I've seen the Medicare pricing percentage range from 140 to 200% of what Medicare would actually charge. But again, this number is negotiated before services are rendered. You'll know what will be accepted and what will be paid prior to those medical services. Most of the time, you know how much the percentage would be when signing up for the actual health plan. Implementing a reference-based pricing plan can potentially lead to cost savings for your plan in a couple of different ways. One, transparency. There's increased transparency. You know ahead of time your cost because it is coming from an established benchmark, most often Medicare. Two, aligning incentives. You establish the goals you have for your health plan, but your goals may not be aligned with those of the insurance company. They too are working to increase revenue and increase margins on their bottom line. The ACA has tried to limit that by mandating that 80% of the insurance premiums are spent on medical claims. They can either increase the number of lives they cover or increase the average cost of claims per life covered. Unfortunately, the latter part could happen. You might be wondering if a level-funded health plan with a reference-based pricing model is the right solution for you and your business. It might be, but it is something that you need to consider and to be aware of. The more plan options you are aware of, the better equipped you can be to implement the right solution for your business. Click on the link to my calendar to learn more about these options. Have a great rest of your week.